Number 6 in the previous slide. Number 6, encourage and empower students to engage with the student experience. What do you mean by the student experience?
So this comes up a lot whenever I talk to my old supervisors sort of working in psychology and things like that, and they're talking about their children that are currently at university, and they said, oh, well, academically, she's performing really well. She's getting all the grades there, but does she have any friends? No. Is she engaged in any societies? Does she go to the student union? Does she take part in debates? Is she making the most of the other opportunities that you have at university? No. And when I think back to when I was an undergrad, I had tunnel vision. I thought, I'm here to get a degree, I'm here to get a job, I'm not going to engage with anything else, I'm just going to study. And that has a real impact because people benefit by, in terms of the learning, they benefit by having these conversations with other people. So in terms of engaging with the wider student experience, it's coming away from the fact that, oh, you go to uni to get a degree. It's what other opportunities do we have there? What volunteering opportunities can they be getting? What summer placements can they be doing? What are the people on their course like? Meet with them, engage with them. So it's beyond the sort of narrow, the academic side.
In that case, then, it sounds like what you're describing is extracurricular activities in all its forms. So I'm confused as to why you called it the student experience. Certainly in the university that I'm currently at, the student experience is everything, including the curricular activities. And of course, their satisfaction or their engagement with that is also measured. So I'm wondering why you termed it the student experience, if it's a particular aspect that you're talking about.
Well, I suppose I wouldn't necessarily see them as extracurricular activities because it can be embedded with a lot of the learning itself. So a lot of our tutor groups are within groups. Yes, we have one-to-one groups and they have, one-to-one meetings, but then they also have group meetings too. And what's interesting is that when you talk to students, when they say, how do they compare group meetings to one-to-one meetings, they say, oh, I don't really like going to the group meetings because I don't really know anyone in my group. I prefer the one-to-one things because I know it's about me and I can talk about things that I feel comfortable disclosing to my personal tutor that I wouldn't feel comfortable disclosing to the rest of those people in my group. And then you say, okay, well, who are the other students in your group? And they say, I don't really know their names. So in terms of engaging, not just seeing it as the academic side, in terms of engaging, having these conversations with other students in their group, being able to feel confident that they can engage with the whole experience of university. I think it's not necessarily an extracurricular thing. I think we need to be encouraging students to have the confidence to engage with the rest of their cohort.
Thanks. All very interesting. I just wondered if you could say a little bit more about number 1. I was interested to see that training is a contentious topic, and in my experience of personal tutoring, it's a lack of training that's been a problem rather than not wanting training. But I wondered if that was particularly in relation to training around mental health, so that tutors don't want to become counsellors, or anything else you could say about that.
Yeah, it's very much in the context of whether we offer training and how we go about offering training. Because if we did offer training, I don't think it would have to be in the traditional sense, but it's specifically within the context of personal tutors supporting students with mental health issues, because this brings it back round to duty of care, responsibility. So in a lot of the conversations that were reported in that report, and what we find in a lot of the training that we've been going to in RARA, is that staff are like, well, yeah, I do really want to know more. I do want to, some of them talk about mental health first aid training, some of them talk about other things, but then they say, but then with that, I then feel responsible for that student's mental health. I then feel like I'm not going to hand them over if it reaches to the point where it is appropriate for them to hand them over to the counselling service. They said, well, I don't need to because I've got the training and I've got the skills to do it myself. But at the end of the day, they're not a clinical profession. So if a student's mental health does continue to deteriorate, a personal tutor isn't the most appropriate person for them to see. And tutors, I think, recognise that. And so it's developing training in a way which makes them feel prepared and confident, but also recognise when it's no longer within the remit of their role.
Yeah, I was just thinking about number 5 and the idea that, so I've had it a lot in the past that whenever it's time to refer, very often it's a phone number, it's not actually on campus, and so as soon as that happens, then you actually take them back on again anyway, and so those only boundaries become blurred because of the actual resources which just aren't available on most university campuses, which is worse if they're distance students or if they're part-time students or if they're mature students, and that just sort of exacerbates it. So I was wondering like what you think about that sort of like friction, I suppose.
I completely agree, and I think I would link 5 with number 3. So I think part of the issue is absolutely right. We've had a lot of examples. We had a personal tutor say, "Oh, I got an email on Sunday night about a student saying that I'm going to be late in attending class today because," and then they've disclosed something in that email, and then that personal tutor, the academic, they've got it on their phone, they've seen it, and they're like, that responsibility is now with me. What do I do with that? I don't know what to do. And so I think if we linked it with number 3, build links between academic faculties, academics and support services, then the boundaries and what's within the role of a personal tutor would become clearer, because there would be better links to be able to link to other services. So we were saying earlier that actually another thing that's coming up with the RARA project is that even personal tutors who are familiar with the services that are available in support services, they don't have confidence in them. So they'll say, "Oh, I referred a student to whatever, there's a big waiting list, so they've come back to me." And so I think in terms of coming back to, again, Kay's work, building this trust, building this thing, we need that between the services within the institution and across the academics as well, because if they don't trust that the services are going to help the students, then they're not going to refer to them, so of course they're going to come back. So I think it's tackling a number of these all together rather than, and I think they'll have a knock-on effect with the others as well.
Just got one, so if that's all right, if we've got time. My voice is probably loud enough. I just wondered, we seem to be saying almost that personal tutoring is becoming like a caring profession, and then when you look, however you define that, but if we think of caring professions like social work or therapist, for example, then there's a regulatory requirement for supervision. Yeah. And something I've been interested in, and probably colleagues have for a while, is the place of, and should there be a requirement for, supervision within education, and yet it doesn't exist really in any structured form. It's often not thought about. And then the flip side of that debate is writers like Catherine Eccleston and Frank Furedi, who say, you know, education as therapy is to be actively resisted for good reasons in their view. And I just wondered on, coming out of any of this, were there thoughts given to supervision and the other side of that debate?
I think, so first of all, I agree with you, particularly in the background of what my PhD was in. I'm used to meeting with therapists and them talking about their supervision roles. So it is a model that if you take the sort of topic out of it, the model can be quite similar to personal tutoring. I think it's quite risky though, if we then start to say that we're going to regulate and start to say that it's mandatory that we have supervision there. I think the key is that personal tutors need more support, and there's different ways in which we can give more support, and that support might look differently in different institutions. But I think we'll learn about that a lot more out of the RARA project, particularly because we've got the nice contrast with Sheffield and King's. So I'm really quite interested in the senior tutor role that they're doing at King's and learning about how that impacts their personal tutors. But I think in terms of if we regulate them, I think it comes back to the fears of responsibility and duty of care, and it is their time to do these things. So I think there's more organic sort of bottom-up things that we can do. So go to personal tutors. What sort of training? Do you want training? If so, how can we better support you? Is it having the opportunity to engage with other academics on your course to confidently and anonymously share a difficult conversation you've had with a student and not knowing what to do? It may well be that. It may well be. So at Sheffield, we've got something called a clinical liaison role, which is someone based in the counselling service, but basically has a sort of helpline, if you like. So as soon as a personal tutor has an issue that they don't know what to deal with, they can call or go straight to the clinical liaison role. So I think it's looking at the different ways in which we can embed different types of support to personal tutors, but not necessarily just in a regulated way.
One last question. I wonder how the virtual elimination of funding by the government for mental health services in local councils and in the NHS has affected you.
I'm quite glad that you asked that question, actually, because there is another project that I'm working on. So services are being closed. It's very unfortunate. It is hitting FE, so further education, much quicker than HE, because part of the issue there is that there are funding cuts and services are being referred externally for cheaper alternatives. But the issue with that is that we need people that are embedded within the counselling service that are trained and experienced within the student context to deliver that support. So then when you close those services down, or if you reduce their funding to them, then we're really noticing the lack of sort of funding and support right now. But one of the things, so the people who funded my PhD, the British Association for Counselling and Psychotherapy, alongside that, we're working on a project to try to understand how can we better support counselling services. So one of the things that came up is data. So they don't necessarily have the data. So when management or someone higher up in the university says, prove that you're effective, and they say, we're not collecting data, so we can't show that we're effective, they say, okay, we'll close you down, or we'll get rid of a room, or we'll take a member of staff out, or we'll bring in these sort of wellbeing practitioners who aren't necessarily trained in the sort of to deal with the sort of clinical severities that we're seeing, and so that's very much recognised and people are already responding to it. So I do feel quite hopeful that in the next few years, with the support and the collaboration with a lot of people, that hopefully we'll be able to bring back the funding and protect the services and say that these are valued services, they need to be embedded. So it's hard. Mm.